Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Let's get started. We thought we'd do some of the speaking and then have some questions and take a break and then a little bit more since there is so much to cover. So first of all, we titled this Age Strong, Live Long. We feel that seniors are a real asset in our community, that they're a resource that's valuable, and we're very proud to be here helping people who need any kind of support that may come up. We are a combination of providers here. I'm Karen Grimsich, and I'm the administrator for the City of Fremont's Aging and Family Services. So I oversee quite a few programs we're going to touch on a little bit today. We're also lucky to have someone here from our Paratransit program, Shawn, who will follow me, because transportation is obviously a concern for a lot of people as they get older. We also have the director from ElderCare, and we work very closely together in partnership, and she's going to talk, Mary Anderson, about her programs. And then Dr. Ray Grimm is going to talk a little bit about a community-wide strategic plan we have. So we're coming from different places, but all with a common theme. So I wanted to start off to see where you guys are with knowing this. Let's see if we have any guesses. In our Tri-City area, how many people do you think that we have that are over the age of 60? Does anyone have just guesses? 1,000. What are you thinking? Higher? Higher? 5,000? You guys are going to be too many. Who said too many? 2 million. 2 million, we're going lower. Almost 50,000, and this is census data that's a few years old. So with the last round of census that happened this spring, I think we'll see this number go up. In fact, as this is 15% of our Tri-City population, which is a little bit higher than the state average. So almost 50,000. Yeah. And so, this is the Tri-City area. So a lot of the service we'll be talking about we do offer in Fremont, Union City, and Newark. I should say. Hayward's not included in this number. But we do have services that go into Hayward. So, but I was just doing the Tri-City. So it's a lot of folks out there. Okay, you guys, this number's growing. So in the last decade, 2000-2010, the percent of California's older adult population, the data's using 60 plus, increased by what percent? I'm going to give you some choices here, so we're not just guessing numbers. Do you think it's 7%, 15%, 36%, 54%, 78%? So this is in the last 10 years. This is the growth. You guys are good. It's 36. But across the whole United States, I mean, people over 85 are the fastest growing age group we have in our country. So we're talking about, more people who are living well, but may need some support along this path of getting older. So here's a little fun one. I've been talking about big numbers for the state, for our area. But now let's get into our services, which are right here, affecting your neighbors, people your friends. So the average age of a Meals on Wheels recipient is 77. it just kind of gets a little feel for how many people we're serving here. And as we go, we'll give you more information about specific programs. And if you have other questions about, how if services in Hayward and, specific, it's too specific, we may ask you to wait. We'll be around during the break and lunch. But we'd like to make sure that you guys leave here with things you can really use. So here's kind of our commitment. This is where we're coming from. We want to make sure that we're living in a place where there's opportunities that promote wellness and healthy lifestyles for everybody. But our specific target is for older adults. We want people to be independent. We want people to stay at home as long as it's possible. We want to support that. So we're going to talk a little bit about that because most people live well, healthy lives. But we also want to make sure that we're providing or people have access to and know about, which is what's really important today, that people know about other kind of supportive services for people who may need them. And they may need them for a short amount of time. They may need them for a longer period of time. But we want to make sure, and you guys are part of this now. You're on our team. You showed up here today. You're on the team to make sure that people, your neighbors, your friends, people that you do business with, your family, their friends, know that there are places you can get help when people may need them. We also, it's really important to us, kind of a value statement, that we're doing all of our services, all of our interaction with our community, with you, out of respect for all elders, regardless of what their needs may be or who they are. It's a very important part of what we do. And the other part, and you'll see we have a mix of people here today, and it goes even beyond this, and we probably 60 organizations we work with in the Tri-City area, that we are coordinating across care. One of the most frustrating things is if you call one number and they tell you to call another number, and you call another number and they tell you to call another number. We've made a commitment, this is our commitment, to work together as closely as we can as providers of services, so that maybe you're calling because you or someone you know may need a meal delivered through Meals on Wheels. But I tell you, Mary and I are within 4 feet of each other, and our programs are working together to make sure if that person delivering the meal sees that there's another need or hears about something else, we'll try to connect that for you. So this is what we have promised for you. And now what we'd like to is to solicit your help in helping this get out into the community. So I'm going to start with the City of Fremont's programs, very general, and leave you with information to contact us for more. So first of all, we're talking about the wellness and health promotion and people having a place to gather and be with friends. I've got to start off with our senior center. We've got one of the most amazing senior centers here in our backyard down on Lake Elizabeth. There's the phone number there. How many people have ever visited the senior center? Great. Yay. Tell your friends. It's a place that, you could take classes. There's yoga classes. There's exercise classes. There's classes in healthy nutrition. We have a new one in positive psychology about keeping a positive attitude through life. And people who are positive live longer and live well. We also have wellness appointments. You get your blood pressure checked, get your weight checked. There's a nurse there on site. You can volunteer. You can be part of what we're able to provide for the community down there. Exercise is huge. And we've got quite a few different ones. Find one that fits for you, whether it's, a walking program, or we have one Fit for Life that's quite demanding. And people are really showing some real good improvement in, basic blood pressure. We're testing people to see how they're getting healthier, and it's really making a difference. The health screenings and a lot of different cultural clubs meet at the seniors. It's a meeting place for everybody, whether you want to be knitting or you want to come and meet with a group that you have affinity for. So I wanted to start off with that because this is our hope, is that everyone in our community knows a place where they can be well and thrive and connect with people. Now, when people do need more of the supportive services, we're trying to make this as easy for people and get this out there as easy as we can. In fact, in your packet, you'll have a magnet that you can put on your refrigerator. Let us know if you want more for any neighborhood meetings or anything you may be participating in, because we've been focusing on a single phone number to help people answer questions about services, just to call to have someone to talk to. It's right here, the 574-2041. There is a magnet in there, and it's referenced a few times in the material. This is a phone line, Monday through Friday, but that you can talk to a live person, and you'll talk to a person who can speak English, Farsi, Spanish, and Mandarin. Occasionally you'll have to leave a message, particularly for some of the other languages. We will call you back within 24 hours. We'll see what we can do. We'll try to help coordinate that. This phone line is staffed by professional case managers. They will help you. So this is the first when you think someone may need assistance, whether it's yourself, a family member, a neighbor. Just call us. The next level of kind of what happens if someone calls and they do need some help is that we do have a professional team of care managers. So this is a group of people who are trained in social work. We also have nurses, and they can come out and meet with people and kind of come up with a service that the senior themselves define. I may need some help with filling out some paperwork, maybe to some benefits or Social Security, and that happens all the time. Working through our system, healthcare system and social system, can be challenging. This is a guide for people. These are people that can come and either meet you in your home. We've had sometimes people do come to our offices, which are close, but they'll find that solution, and there's all sorts of levels. We have teams that are a social worker come to your home. We have teams that include a nurse when there's a lot of physical conditions that are also being balanced. Our goal is to help people stay home. So even if it's complicated medical conditions, the nurse goes, they'll set up regular appointments, they'll be your guide. So when you call the intake line and you can talk to someone there, and if it looks like there's a need for more in-depth services, the first kind of next level of support is care management. And like I said earlier, people go in and out of this. They may need it for a period after a hospitalization stay, and then they need some support, and then maybe they'll, not need it for a while, and that's fine. Well, maybe they could call us later, but you will be given a person dedicated to your situation. So first the care management. The next is a layer of counseling services that are very important as we journey through life, that you get this kind of support. We have a whole dedicated program to supporting caregivers. I mean, who here either is or knows someone caregiving for somebody? You guys, come on, everyone knows someone who's taking care of someone on some level. And it could be a family member that lives in your house. It could be someone that you're helping bring meals to. I mean, we are a community that's supporting each other. Caregiving in itself has often its own level of demand as being the caregiver. We want to make sure that we're supporting the caregiver too. We are there, of course, to support the older adult. You need to support the caregiver to make sure the older adult is getting what they need. So our dedicated counselor for the caregiver program does support groups, they do retreats, individual counseling. She'll come out to your house, she'll do assessments. She's an amazing woman who's been doing this for a long time, well regarded across the county. Nancy Rothschild, some of you may know her. So that's the first level. If you know anybody who's caregiving who needs a little help, have them call us, and we'll have Nancy connect with them. The next level is actually a mental health, behavioral health program that's fairly new, just a couple years old, but offering really a unique level of service. And this is where we have counseling staff. These are licensed staff who are counselors that can do assessments along with the medication support. So we have a doctor, we have a physician's assistant. So anyone who may be depressed, anxious, we can do the assessment, we can help with medication, we can watch and see how that's working, we can come and do counseling in their home. So this is very important for seniors who find it may be difficult to get to a doctor on a regular basis or get to a counselor on a regular basis. So this is a nice complement to anyone's kind of package of different services. Again, they may need this for a short amount of time. They may be going through a period where life is really tough and they need that extra support. They're sad, they're depressed. And then we can also then, if they do start to feel better, refer them back. Maybe they need case management. So all of our staff meet together once a week to see how we can kind of put pieces together for people. The last one I want to talk about, counseling, which I'm really, really proud of, and we're very unique in our community to have it, is we actually train other older adults to become counselors. It's a peer program. They go through an amazing training. It's 54 hours. It's intense. They're a strong group. We have a lot of language capacity in this group right now. They can go visit with seniors and also provide counseling. Now, these are folks who are, maybe don't need a highest level of counseling or the, psychiatrist help that our mobile mental health program has, but there's someone who could use someone who understands what it feels like to be isolated or lonely or depressed or to be grieving. A lot of seniors are grieving. And what's again nice is that our senior peer counselors may go out to someone's house who's been a recent widow and, and support them. If they think things need to be taken to another level, they can refer then to our psychiatrist for more evaluation, or they can refer to these other programs you'll hear about. So anybody who has a need, just have them call us and we'll try to connect them up. Okay, so we talked about the senior center and wellness. We talked about the care managers, which are guides, and the counseling services. I also want to make sure that you are aware that everything we do we are embracing the diversity of our community. And I think everyone down here in this Tri-City area realizes that we live in a rich, rich community. In fact, 47% of people in our community are foreign born, and 57% speak a language other than English in their home. So we need to make sure that the services we're doing, again, our commitment to you, our community, is that our services are able to support people who have different perspectives, different language skills. That's a commitment that we've made. One of our really exciting programs is called the Community Ambassadors Program, and to date we've trained 140 volunteers. They go through a 40-hour training. They have the capacity as a group to speak over 30 languages. They're an amazing group dedicated to being that connection to people in our community. So they understand about our services and community services extremely well. They can help people fill out forms, they can help people connect, kind of an information and referral, but a ripple effect. So we've trained these 140 people in the community, and then they can go out to where they know people, and believe me, they're from a lot of different ethnic cultural groups in our community, and be that bridge to help people. A lot of times seniors, it's great that you guys all came here, we're meeting together, we can get a lot of information out in one place. A lot of people feel more comfortable asking questions about assistance in a very familiar group. It could be their temple, their church, someplace where, especially seniors, where they gather anyway. So our goal with the Community Ambassadors Program is that we're training people that can then be available to seniors where seniors are, and then help them understand what they need. And after this 40-hour training, they continue to meet with us on a regular basis so that they're familiar with a lot of the services and stay up to date, like if Social Security rules change, and so we can make sure they're helping people in the community. So I just wanted to, it's a program that's really made a big difference in our community, and I just wanted to get that out there. We also have specific programs that are done through the City of Fremont in partnership, especially one with the Afghan Elderly Association that's a health promoter program. And this is training Afghans, and they're actually given a stipend to help health and wellness within their community. So we're looking at diabetes, and we're looking at high blood pressure and trying to monitor and get people down. We've had amazing results. It's run through a public health grant. We've got a nurse who can help us, and it's, of course, done in a language that's comfortable for folks. Other examples, I just wanted to put them out here, is the Muslim Support Network, Afghan Care. We have a lot of cultural clubs that meet at the senior center. So I just want to make sure that as you guys are out in the community, you realize our commitment is to be as inclusive as possible in helping seniors. So we will look at language capacity, we'll look at cultural differences, and we'll look at a full spectrum of different types of services. I think that's it for my part. I'm going to keep us moving and introduce Shawn Fong, and we're really fortunate in our area to have someone who's a specialist in mobility and transportation issues, because this often comes up, as you know, a challenge in people's lives to be able to get to places they need to go.
So good morning, everybody. My name is Shawn Fong, and I see some familiar faces out there. Welcome to today's program. So think of me as your transportation and mobility resource specialist in the community. Whether you live here in Fremont, Newark, Union City, I can oftentimes help get questions answered and get people connected with services. Before I start my presentation, I just want to see a show of hands. How many folks in the room are still driving? So a fair number of folks, okay. How many of you have thought about the issue of driving retirement? Okay, couple people. So a lot of times as we get older, as I've spoken to a lot of seniors, they think a lot about as they're going to retire from work and what they're going to do and what their retirement years are going to look like. A lot of folks don't really think a whole lot about what happens when they get to the point where they may no longer be able to drive as much as they're currently driving, or they may no longer be able to drive at all. We're seeing that research is now showing that seniors nowadays are outliving their driving ability by 7 to 10 years. So what do you do in the meantime, right? And I had this very personal experience last summer because my dad, who's a fairly young senior, he's in his late 60s, last summer he was driving, very active, everything was going great, and then the next moment he had a stroke, and the next day he wasn't driving anymore. So it's really important to think about, in a situation that's not a crisis situation, to sort of prepare yourself to think about what are the resources that are available in my community to help me get around, to help me continue to be active, stay a vital part of my own life and be active in the things that I enjoy, get to my doctor's appointments, do my grocery shopping, all of that. So we are very lucky to be in a community where there are seniors that have engaged with us around these issues to think about what kinds of services and continuum of services we can provide to folks. So I'm going to talk a little bit about paratransit services and some supplemental resource programs that are available to help seniors stay mobile and active and connected with all the services they need in the community. So let's first talk about paratransit. Now, many people have seen paratransit vehicles in the community, you know, whether it's East Bay paratransit vehicles, Union City paratransit vehicles, the Newark or the Fremont paratransit vehicles. And to give you a little idea of what paratransit is about, is for that senior, there are typically 2 levels of eligibility for paratransit services. Either you have to be disabled to the point where you're not able to use public transportation, that is the local buses or BART trains, to get to where you need to get to in the community. So for example, someone who has very severe arthritis, right, who maybe the bus stop is maybe 4 blocks from their house, but they have such severe arthritis that they can only really walk comfortably maybe 1 or 2 blocks. Or someone who has some kind of respiratory condition where they get so short of breath they can't walk the distance to get to the bus stop and take the bus and get to where they need to be. So often with paratransit services, you'll have, they're set up for those folks that are disabled to the point where they can't use the regular public transit system some or all of the time. And we're very fortunate in our area here that we kind of have 2 different levels of paratransit services. We have the paratransit services that are run by the transit agencies. So East Bay Paratransit is run by AC Transit and BART, right? And they provide paratransit services for a very wide area, most of Alameda County, and they actually provide service into San Francisco as well. And then we also have Union City Paratransit. Union City is a quirky little city in that they have their own bus system, so they also provide a paratransit service for people that can't use their local bus system. Excuse me. Then we have the next tier of services, which are the city-operated programs. For those of you who may remember, back in the year 2000, there was a measure called Measure B that the voters approved that took some sales tax money and said, we're going to support special transportation for seniors and people with disabilities. And that money came down for our local area here to Fremont, Newark, and some money also went to Union City to expand and provide supplemental paratransit services to the community. So for those of you that live in Fremont and Newark, in addition to to being eligible for services based on disability, you also are eligible for paratransit services if you are of a certain age. Okay? So for example, if you live in the city of Fremont and you're 80 years of age or older, regardless of your disability status, you automatically qualify for paratransit services. So now let me talk a little bit about what this paratransit service is. The paratransit services are essentially their door-to-door transportation services that are provided in lift-equipped vehicles, so to be able to accommodate people who are in wheelchairs or scooters, or if you use a walker and you can't manage the steps to get up on a vehicle, or you just have such bad arthritis or whatever it may be that you may not use a mobility device, but the vehicles are still accessible. So this service provides transportation to doctor's appointments, grocery stores, errands, senior center, worship services. Trip purpose doesn't matter. We have people that are taking, the paratransit services for all sorts of different needs, going and getting their hair cut once a month or whatever it may be. The key thing about paratransit services, in order to get access to them, you have to apply for the services and become certified as eligible to use the program before you're able to arrange the transportation. And the other thing about paratransit services in our local area, any of the programs that I'd mentioned before, is that they are done by advance reservation. So unlike just kind of getting in a car and going, or getting on a bus and going, it takes a little bit more planning. But with that planning, we're able to effectively use the vehicles and transport a fair number of people to where they need to go. Our Fremont Paratransit program alone provides about 1,100 trips per month throughout the Tri-City area. East Bay Paratransit, which is a very large paratransit service system covering that whole area that I talked about, they actually provide over 1,000 trips per day. So we transport a lot of people to the needed services and activities they want to be involved in the community. A couple other common features about paratransit services is that they are shared ride services. So if we've got, two people that live over in the Irvington area and one person is going to Washington Hospital and the other person that's going to the hub, they might get paired up together in the same vehicle and share the transportation. All of these services are very affordable services, so that whether you're talking about the city-based paratransit programs or the ADA paratransit programs, they're all going to cost somewhere in the range of $2 to $3 per ride, which, how many people can tell me how much gas costs these days? So it's a very affordable program. The fare that folks pay to be involved in the service is actually just a small percentage of what the cost is for the service, but we get other funding to make sure that that service is here available for folks to get around in the community. And a key piece is that if someone needs to travel on paratransit and they need help, that is, if they need someone to push their wheelchair, or they need someone to go with them grocery shopping and carry their packages, or any kind of assistance that's needed when they're traveling about in the community, those people that we deem as personal care attendants travel at no cost. Okay? So that's a little bit common features. And now let me talk about some of the differences between the programs. And I think I included information in packets so that if you have specific information about programs, you can refer there, and then I'll also be available for questions and answers as well. But some of the major differences between the programs is that they do have different applications and slightly different eligibility requirements, as I mentioned before, disability versus age, etc. The programs in our area may have slightly different service areas and service hours. So, with East Bay Paratransit, for instance, I mentioned they travel all over the place into San Francisco, pretty much all throughout Alameda County. If someone were enrolled with the local City of Fremont program, we only provide services within Fremont, Newark, and Union City. So some slight differences there. And the fares and tickets or fare media are slightly different. And the amount of reservation notice required for rides, as well as the length of the pickup window, is also a little bit different from program to program. But this is all information that people get familiar with once they get enrolled in the service so that they know how to use the service and make sure that it fits their needs. Now, a lot of times people will ask, well, what about the assistance? Can I get assistance from the paratransit drivers, right? That these drivers for paratransit services are actually go through extensive training, not just about driving vehicles, because some of the vehicles are, bigger vans. You've probably seen them running around in the community. They get not just training on driving those vehicles, but they get training on working with seniors and people with disabilities. They get training on different kinds of sensitivity issues, how to work with people that are visually impaired, how to work with people that are in wheelchairs, etc. And the drivers can provide some level of assistance to someone who's riding paratransit. So the kinds of assistance they can provide are things like pushing a wheelchair, offering an arm to help the person walk safely and get to and from the vehicle. Okay? They can help the person get on and off the vehicle and to the front door or lobby of a public building or to the front door of their residence. They can secure the wheelchairs and mobility devices in the vehicle and assist in securing seat belts. And they can carry a small amount of packages. Some of the things that drivers can't do are things like assist the person getting into their home. Or if the person is, say, coming to this building, helping them, walking with them, not just to the front lobby, but then up to the second floor, because they can't leave sight of their vehicle. But there's a fair amount that people can get assistance from in terms of the drivers. Now, I'm going to move on to talk about a different program that actually came into existence partly because we found that a lot of people were enrolled with paratransit services but were never using it. And when we began to explore with those seniors, well, how come you're enrolled with this service? You probably have to get around, right, to get to your doctors and other places. And then what we found when we talked to them was that they didn't have a friend or a relative or a paid caregiver who could go with them, and that oftentimes these folks needed a lot more assistance than what the paratransit drivers could provide. They needed actually someone to stay with them as they went out and went to their medical appointment or did their grocery shopping or their errand. But those folks weren't getting out, and they were homebound, and they were cut off from their services. So we connected up with Life ElderCare, who you'll hear from in a moment, to actually work with Life ElderCare to provide door-through-door assisted transportation for seniors and people with disabilities who don't have that person who can provide that destination assistance to them and accompany them on those medical appointments and grocery shopping trips and errands. And these are where volunteer drivers and escorts provide transportation as well as the destination assistance to ambulatory individuals. And then also we have volunteers who provide escort assistance and go with people who are in wheelchairs on the paratransit and accompany them on those trips that they need. And destination assistance can be things like helping to push the wheelchair, up to the second floor of a building, assisting with grocery shopping, helping to take the packages into someone's home and helping them pack away their groceries, etc. It's been an incredibly valuable program, and we've been getting grant funding from the Alameda County Transportation Improvement Authority to do this program over the past number of years, and we coordinate both with the Fremont, Newark, and Union City to bring this program to the community. When I mentioned paratransit services, right, I mentioned that all of those services are done by advance reservation. So you go, well, what if I need to get someplace on the same day? And we heard a lot of seniors say that to us, and what we then did was we explored, is there a way for us to provide an alternative for paratransit riders to get around in the community when they needed same-day transportation services? So we were able to get some grant funding to start up what we are calling the Tri-City Taxi Voucher Program. And this is a subsidized taxi service, now only for paratransit riders in Fremont, Newark, and Union City. This is a same-day transportation service that's available Monday through Friday, Monday through Sunday, from 8 a.m. to 8 p.m. And the way that this program works is that those paratransit riders who need same-day transportation can purchase from their respective cities taxi vouchers at the cost of $3 per voucher, and then that taxi voucher then subsidizes up to $12 in taximeter fare. So, each person then can use their vouchers. They can use either 1 or 2 vouchers per trip. It's mostly for local trips, again, within the Tri-City area. And if they take a taxi ride and that taxi ride is, say, $15, they could use 1 voucher and then they pay the difference between the voucher subsidy and the taximeter fare, $3, an additional $3 to the driver plus a tip. And they've now gotten a more affordable same-day transportation option that our local paratransit services can't provide. So again, we've been lucky to get funding through the Alameda County Transportation Improvement Authority and have partnered with Fremont, Newark, and Union City to do this program. Unfortunately, that program is only going to be funded through June 30th of next year, so we're sort of scrambling to figure out how to ensure that that service, June 30th of 2011. Sorry. It was originally scheduled to be funded only through today, and we were able to get additional funding for another year, and we'll see what happens next year. And then another thing I want to touch on is, okay, well, some folks may not qualify for paratransit services because they don't meet the disability or age criteria. How many of you have ever gotten on BART or a bus before? Okay, so a fair number of folks. So that's great because, you know, public transit, I remember when I went to New York City, gosh, this was about a year ago, I met a couple who were in their 80s at a restaurant where I was having dinner, who their whole life had never had a driver's license, lived in Manhattan, had taken the subway out to Brooklyn to have dinner, never ever, except for occasionally getting in cabs, basically used the subway and buses their whole entire life. Now, New York City is really different than suburban Tri-City area, right? But we still have public transit services here that do serve the local hospitals, healthcare facilities, senior centers, shopping centers, etc. And we have a great program that we've been running now for almost 4 years, where we provide free workshops to seniors and younger folks with disabilities to teach them how to use the public transit system. And that includes the AC Transit buses, BART, Union City Transit. And it's a 2-part workshop where we teach people in the classroom, and then we have a part of the workshop where we actually then have planned an outing that we're going to do on public transit, and we take people out on public transit and give them the firsthand experience of, you know, how do you ride transit? How do you pay for the ticket? How do you figure out where you're going so you don't get lost? How do you make sure you board the right bus? All of those kinds of things we do in the context of this workshop. So, and every participant that goes through this program then gets a free bus and a free BART pass to continue using public transit after the workshop. And we additionally provide extra coaching to folks after the workshop. And one thing that we started recently is that we found that some seniors went through our program, but they were still, you know, they got a little familiar with using public transit, but not 100% familiar. So we started up some great fun outings in the community to different destinations. This we started up in April, and we have taken groups of seniors on public transit. The first trip we did was we took a group of 15 seniors on the BART and on Muni and went over to the DeYoung Museum to see the Bouquets to Art exhibit, so that the seniors, in the context of a group setting, the safety of a group setting, could again try out using public transit and see what other kinds of fun things there were to do in the community. So that's our travel training program. The last thing I'm going to mention is, and I see some of you that are involved in this program, is our walking program that's called Walk This Way, that started up last summer through a special 2-year grant. And this is a free 16-week program that combines walking, flexibility, strength, and balance exercises with fun games and educational topics. And this program has been great because the seniors who go through it, you know, have seen things like reductions in blood pressure, you know, their diabetes going away. They've just seen higher levels of fitness and health, and improved balance, strength, all of these things. And again, this is it's a fun program, It's a very low impact program. We've had very fit people join the program. We've had seniors who have used walkers join the program. So we actually have our next series of Walk This Way programs that are coming up. And I think there are flyers in your packets about the upcoming Walk This Way programs. And if you are interested in signing up with one of those programs, I'm more than happy to take your name and get you signed up today. We have a program starting up in Fremont in the middle of July, and then in Newark and Union City in September. So that's a little bit on the package of mobility and transportation services that we have for the Tri-City area. I think we're going to take a break and take a 10-minute break and reconvene at 25 past to continue our presentation. And certainly, if you have questions, we will be entertaining those, I think, towards the end of the program. Thank you.
Our focus so far has been on the whole issue of age strong, live long. And I think, this general topic sort of reminds us all that we need to rethink how we prepare ourselves for the fact that we are growing older, and that growing older isn't just what happens to somebody else. And it is that one thing that each and every one of us have in common. And to me, as I think about that, I think about then, as you are growing older, try to think about what would you do differently if you knew that you were going to be living to be 100 years of age plus. How would you want to be treated? How would you want others to be thinking about you, to view you, to be responding to you and to your needs? And what are the planning factors in this process that really are necessary for you to enjoy having your continued quality of life? I think it really is an important issue for each and every one of us to focus on as we are aging. And our now rapidly growing aging population truly does suggest that there are many challenges and opportunities along this path that can include leadership, vision, and a real sense of involvement. And as we've talked about here, in really helping each other as we are going through this aging process. And it is indeed a lifelong process. And it really is important then that we make certain that we understand and are able to access all the very important services that are available to us in this aging process and during the course of our lifespan. Earlier this morning, you did hear about the many programs that the City of Fremont Human Services Department has to offer. And I think one of the strongest components in this process is the fact that there have been viable partnerships that have existed with government, business, social service agencies, politicians, hospitals, and individuals like yourselves that are coming together on behalf of a common agenda where seniors feel understood, valued, and involved. My name is Mary Anderson, and I am the Executive Director at Life ElderCare. And Life ElderCare is a nonprofit organization that really does focus on the basics of life: food, friendship, and increased mobility, so that seniors can continue living independently in their own homes for as long as safely possible. We are housed within the City of Fremont Human Services offices, so it really does provide a very unique opportunity for us to work side by side and make sure that we are providing a seamless net of services on behalf of seniors within our community. Life ElderCare as an organization is really all about people. It's people in our community. It's frail homebound seniors that really need help now, and it's about volunteers, those individuals in our community who are so willing to give that wonderful gift of their time to make life just a little bit better for the more vulnerable members of our community. And when you think about it, when we are children, independence is a dream. And when we are adults, independence is a reality. But when we start to grow older, that fear, that thought of losing our independence really does become our greatest fear. And it really is sort of an alienating and can be frightening at times feeling to think, you get up in the morning, you look in the mirror and you think, who is that person? I am who I was. And so it's really important that we do have the services in place that can help with our aging process. So Life Elder Care was established in 1976, and through our direct service programs, we provide Meals on Wheels, friendly visitors, VIP rides, and a falls prevention program, all geared towards allowing people to remain independent. And I'm going to spend just a few minutes in talking about each one of these programs. Our Meals on Wheels program, we just started out, Life Elder Care did, with the Meals on Wheels program at inception. And this program was actually started by a local resident here in Fremont. And she was concerned about the nutritional needs of seniors. So she prepared a program whereby the meals would be prepared and packaged at a local school kitchen, and then they were delivered by a group of volunteers. And during that first year of service, there were about 350 meals that were delivered within the Fremont area. And today, just to show you and talk about growth, today in the Tri-City area, Fremont, Newark, and Union City, the end of the fiscal year is today, we expect to have delivered close to 95,000 meals in the Tri-City area. So we've definitely grown a bit. And there definitely is a real demand for service. And then one of the things I wanted to point out that I think is very important about the Meals on Wheels program is that while we talk about there'll always be that very vulnerable population of seniors that we need to take care of and to serve and who need more services than ever. And the Meals on Wheels program truly is a lifeline for them. But it also can be a lifeline for individuals that just need it on a short-term basis. Say, for example, you were hospitalized and you had anything ranging from pneumonia to a broken hip, and you wanted to go back home rather than into a short-term care facility, but you just didn't have those features in place that were going to enable you to do so. Well, the programs that Life Elder Care provides, and in particular Meals on Wheels, perhaps can make that happen, so you can go home. And so many of our individuals on the Meals on Wheels program do so on a short-term basis, just so they can get that daily nutritious meal and that they can get what we call the daily wellness check. So let me explain a little bit how the program works. The meals are prepared at Valley Care Hospital in Livermore, and then they're delivered to our parking lot at the city offices, where we have some 24 volunteers that are waiting to then go on their respective routes in delivering the meals, the daily meals. And the meals are delivered between the hours of 10:30 to 12:30. And we have about 9 individual types of diets that are available. So they pretty much are able to meet everybody's nutritional need. And when that volunteer knocks on the door to deliver that meal, not only are they providing that hot, nutritious meal for the senior, but also they are providing what we call as the daily wellness check. They're making sure that that senior is up and about and doing okay. And if there are any issues of concern, they're able to call our office, and we are able to take the appropriate follow-up steps. This is not only reassuring for a family member, but it also is very reassuring for the individual themselves. They really look forward to. Many of our seniors have their door open and they're sitting at the table and they're waiting for you to come in and have a little bit of a visit and enjoy their meal. So it's a wonderful aspect of some socialization, because for some of the seniors on this program, that volunteer might be the only person that they see throughout the day. Another thing that is interesting about the Meals on Wheels program is the fact that we actually have had some volunteers that have saved lives. A senior perhaps has fallen during the course of the night, and if it weren't for that volunteer that would be stopping in, they might have had difficulty and sometimes, even death, unfortunately. So that daily visit that's provided by the volunteer really does make a significant difference. Another element that we think is very positive regarding this program is the fact that we have partnered with Cal State East Bay Nursing Department fourth-year nursing students. So twice a year they go out and visit the senior and are able to check on them as far as their health concerns, as far as presenting other programs on behalf of the city support, as well as Life Elder Care, to make sure that, again, we are meeting the needs, that things haven't changed. That they can't perhaps have more services. And so there is that element that is provided as well, that is a little bit of a medical model, if you will. The nursing students take blood pressure checks, and again, sometimes there really have been follow-ups that have been able to have taken place between the senior and the doctor as a result of that visit. So it really is a lifeline for many individuals in the community. The next program I wanted to talk about is our Friendly Visitor Program. And this really was truly an outgrowth of the Meals on Wheels program, because as our volunteers were visiting with seniors on the Meals on Wheels program, they found that many of them were lonely, that they either had moved to this area to be close to their children, their friends had died, had moved away, they didn't have the transportation access that they used to have in the past, so they really were lonely. And so we established then in 1985 the Friendly Visitor Program. And the Friendly Visitor Program matches volunteers with seniors who would like a friend. And as simplistic as it sounds, I think we all would agree to the fact that there's nothing in life that really is more important than having a good friend, someone that you can spend some quality time with. And this program, we ask that a volunteer spends a minimum of 2 hours a week with the senior. And they can do anything. They can just sit together and have a conversation. They can play a game. They can go for a walk around the lake. They can go to a movie, go to lunch, whatever the two are interested in doing together. And as a matter of fact, there was one volunteer who brought her senior to her backyard because the senior had lived in England, and she was so lonely for her previous backyard because it was filled with all these beautiful flowers and rose bushes, and the volunteer had rose bushes, so they just sat out in the yard and enjoyed the beauty of and smelled the roses. So it really can be any kind of form of really what the two of them like to do the best. And the volunteers on this program are from all walks of life. They're young, they're couples sometimes engage in volunteering with a senior. And not long ago, our coordinator of the program had a training session for the volunteers. And I was so interested because there was a young man from Ghana. He was 28 years old from Ghana. And he had been matched with a 90-year-old widower from Montana. And I thought to myself, as he was talking, I thought, what do these two people possibly have in common? And so I talked to him after the program, and he said, you'd be surprised. He said, we have a lot of things to talk about. He said, but you know what we like to do best? We like to tell jokes. He said, we have a lot of good jokes to tell each other. And he said, and I just listen. And he said, but you know, it goes beyond that. He said, we have a philosophy in our country, and it goes something to the effect of, if he has been there to see the development of our teeth, we need to be there to see the deterioration of theirs. And I thought it was really a wonderful commentary on how we can share strengths and weaknesses and how we really can be present for each other in various walks of life. Our falls prevention program was started in 2004, and as I'm sure many of you have certainly have heard some of the statistics, falls are the 5th leading cause of death for individuals who are 65 years of age and older. And based on the statistics in Alameda County, 1/3 of older adults fall, and that annually, and that translates into 7,600 seniors per year. And of those injuries, hip injuries is the most common injury, and that results in an annual cost of $3.4 billion. So not only is it costly, but it really also translates into a very significant loss of independence for Tri-City seniors, and the prospect of being placed in a skilled nursing facility, which is something obviously people want to try and avoid. So Life ElderCare established the Falls Prevention Program, and it is a multifaceted program in that it includes in-home exercise, it includes a safety home assessment with some suggested minor home modifications if the senior is interested, and lastly, a medication review. As I think many of you would agree with, as we get older, there are sometimes more meds than we're on, or we see different doctors for different purposes, and sometimes those medicines, without our even knowing it, can be at cross purposes and can cause for some dizziness and lead, unfortunately, to a fall. So going back to our in-home exercise program, it really is a wonderful, wonderful program. If you were interested, let's just say you thought, yeah, I'd really like to know a bit more about this in-home exercise program. So we would have a physical therapy assistant go to your home, and she would do a healthcare assessment on you, ask you some questions, check your dexterity, mobility level. There's a couple of basic standard tests that she would ask you to do. They're very simple. And then she would suggest a series of exercises for you to do on your own. These would need to be approved by your doctor. And then following that, you would be asked to do these exercises every day in your home. And then once a week, we would have a student nurse from Unitech College. We partnered with Unitech College. And a student nurse would come to your home, sort of serve as your coach and work with you, answer any questions that you may have, sometimes even do the exercises with you. But check and see how you were doing, and then document that and work with you during the course of the next 12 weeks. There have been some individuals who have, at the end of 12 weeks, said, you know, I'm really not ready to do this on my own. And so then you can sign up for another 12-week period. But the results of this program have been absolutely phenomenal, because people not only have increased their mobility level, their dexterity, and their flexibility, but they also aren't quite as afraid about having falls anymore as perhaps they had been before. Because that also is something that can lead to falls. So this program has made some significant strides in that respect. And we have had a total to date of about 1,500 seniors that have gone through this program. And I will just share in telling you one story on behalf of this program. And we had a woman that had joined the program. She'd had a stroke, and she actually was bedridden. And she wanted to join the program because she wanted just to do some upper strengthening body exercises. So she did this for a 12-week period. She asked if she could continue, which she did. And by the end of 36 weeks, she was standing alongside her bed with her walker. And it was such a new day dawning for her. She was so pleased with her ability to actually be on her 2 feet again, that she said to us not long ago, she said, you know, she said, if I continue at the rate I'm going, I may be 76 years old, but I'm going to be in that car and I'm going to be driving and I'm going back to work. So I think it really can provide a new lease on life, and most importantly, it can prevent those falls and really provide more quality of life. Just to touch again upon the home safety assessments, those are just they very often can be in a senior's home just from throw rugs that potentially can be lead to a fall, or lighting maybe not be as good, grab bars in the bathroom, things like that that really can be done. And these are things that Life Elder Care, the Falls Prevention Program, does take care of at no cost to the senior. So it is really a very, very positive program. And last but not least, and this was covered a little bit, Shawn did with the VIP Rides program, but I can't tell you what a wonderful program this has been, and a result of the City of Fremont focus groups that were held in early 2000 that really did cite transportation as being a significant issue. And again, it sort of ties back to this whole isolation issue and people really getting out and about in the community, and most importantly, getting to very needed and necessary medical appointments. So again, this program is for those seniors who need door-through-door support and do not have the other family support, caregiver, friend capacity in getting these individuals to their necessary appointments or on shopping, necessary shopping trips, grocery shopping, etc. So we have trained volunteers who go through an orientation period, and all of our volunteers, by the way, are screened. Criminal background checks are done on all of our volunteers. But this program really will enable, again, individuals to get to their necessary appointments. And it can be from just providing that steadying arm to pushing a wheelchair. The volunteers go on paratransit, and then ambulatory seniors have the opportunity to go in a volunteer's own vehicle. And again, just a very quick story on that I think sort of sums it all up in the value of this program. We had a senior that actually had been on Coumadin, blood thinner medication, and she no longer was taking her Coumadin because she simply couldn't get and have the lab work done on a monthly regular basis. And so she stopped for a significant period of time, heard about our program, called us up. She was enrolled, and she started going back to her appointments. After her first appointment, she called us up and she said, I have to tell you, she said, I loved my paratransit driver. My volunteer was fantastic. And all I can say is I surely hope I have to have blood drawn again real soon so I can go on another trip. So I think it really is a way that not only enables seniors to do the things they want to do, but it really also makes them feel much more a part of the community. So in conclusion, I just want to comment that these services really do provide a very affordable option. Actually, all of our programs are at no cost, direct cost to seniors. We do ask on behalf of the Meals on Wheels program and the VIP Rides program that a donation is made, particularly for Meals on Wheels, a donation is made if possible toward the cost of the meal, but that is not at all necessary. If the senior is not able to do so, indeed we do continue to provide that meal. So they are alternatives to both obviously short-term and long-term care needs that enables people to really age in place. And again, going back to the age strong, live long, we all want to live a longer and healthier life. And Life Elder Care really is all about longevity. And the programs that we have, the direct service programs that we have, certainly can provide an opportunity for seniors to be valued, not only in us providing those services, but also there perhaps can be ways that our seniors too can have the opportunity to get back to the community and want to serve themselves as a volunteer, when we're certainly always open and willing, and it's a very needed effort for us. So when you think about it, this is the most elder-rich period that we've ever gone through at this time period. So how we really use this time period truly can be a wonderful windfall and define the world in which we live. We look forward to that, and we look forward to this process really as an opportunity where in our community, the community itself really will become and transform to become the long-term care system. So thank you very much, and I'll be happy to entertain any questions at the conclusion, but at this time it is my pleasure to introduce Dr. Ray Grimm, the coordinator of Pathways to Positive Aging.
So hello, I'm Dr. Ray Grimm. I've been with actually the city for about 25 years. So I have an investment in these programs in the sense that I plan on growing older here, and I want to make sure everything's in place when I get up there. So, and I'm getting there a little quicker than I thought I might be, so I'm joining in. So my role with the city now is coordinating the development of a community strategic plan for older adults called Pathways to Positive Aging, which resulted out of a partnership between the Tri-City Elder Coalition, which is currently a coalition of over 60 agencies, government and for-profit, non-profit agencies who are working together to decrease duplication of services and improve services for older adults across the Tri-City area. So you've seen a lot of programs today. The question is, where do all these ideas come from? They don't just crop up. A lot of this comes from the fact that within this area, we have a history of talking to people and older adults and asking what are the needs that are specific to our area. And that's basically what the Pathways to Positive Aging initiative is about. We actively engage with seniors in the design of this. We're asking people, what do you want? What do we need? What do you see that we need in the future to create change in our community so we have a healthy community here? We promote partnerships with non-traditional groups. Unlike many Bay Area cities, my partner, Asha Chandra, who's a co-coordinator with this project, we go out and we talk to a lot of groups. In the beginning, we've talked to several agencies. We went to churches, we went to gurdwaras, we went to mosques, we went to temples. You name it, we were out there talking to people about what they needed. We also take a look at, as we'll see, that a person as they get older has multiple areas of their lives. It's not just about food, it's not just about transportation, it's also about families, it's about friends. So we're looking at what are the multiple aspects that make growing older quality. What makes it good? I don't want to just grow older. I don't want to live to be 120 if I can't speak and I can't move. I want to be able to be engaged in my community. And that's what this project, Pathways to Positive Aging, is addressing within our specific area. So the other thing that's been most important from the very beginning is of this project, which is about 6 years old now, is enlisting the community as our long-term care system. Traditionally, long-term care systems have been seen as the hospitals and the skilled nursing facilities. Well, we basically said, and we heard Mrs. Clinton say many years ago, it takes a village to raise a child. We believe that it takes a community to bring quality of life to seniors and older adults, that we all need to be engaged in the process. So when we first began to think about this, we felt that the older adult needed to be the center of our efforts, but we also needed to involve family members, and then we also needed to involve businesses, our social service and nonprofit agencies in the area, in our spiritual organization, and our legal, financial, leisure, that all of these aspects, transportation and mental health, were all important in order to lead a good quality of life, and that we needed to impact local, state, and federal policy that makes communities a better place to live as we grow older. So this is sort of the foundation of how we wanted to proceed. But we added one other layer to this. And the layer is, as you take a look at this, this all looks like services oriented towards the older adults. But we wanted to flip that and say, no, this is a bi-directional model in the sense that all of these levels are also places that we can volunteer in our community. That as you're older, it's not just about receiving services, but the question is where can you get involved to make your life better? Because what do we know that contributes best to quality of life in later life? And the research shows it over and over again, is people who are engaged in the community are healthier, live longer, live better quality of lives. In fact, the psychological of the health of community actually reflects and determines the economic health of the community. The more opportunities we provide for people in the area, the healthier financially and mentally people are within the community. So we want to engage people. And as you see with every program that's been discussed here, there's actually a role for you. And we'll talk about that towards the end of my piece here. So when we engaged in 2005, we were very involved in inclusive processes, in getting started off on the right foot. We talked to many agencies. We ran 14 focus groups throughout the Tri-City area in 9 different languages. We had 2 very large community dialogues. So when we began our initial strategic plan in 2005, we had between 2,000 to 3,000 voices that had a say in the development of the community strategic plan. And I'm going to show you what those overall goals are in the next slide. In 2009, in June, we revisited the plan with the community, held a community dialogue to say, how are we doing? Are we on track? And in fact, most people at that place said, yes, you are on track, and here's a couple other ideas that we'd like you to think about. And we will be doing these community dialogues every couple of years in the future to make sure that we're addressing your needs. So we've flipped this from those in the head of government saying what you need to being your ears to develop what you feel is most important in your lives to make your lives very viable. And to be honest with you, like I say, I'm a few years away from retirement. I want these things in place when I retire so I can remain healthy. So I'm invested in this. These are some of the quick goals that came out in 2005. I'm going to go over them quickly. We did develop a leadership team, the Tri-City Elder Coalition, which oversees this. We have meetings every other month. We have one coming up on Tuesday, July the 20th, which will meet at the Centerville Community Center at 11 o'clock. And those are opened up to anybody in the community. We bring in a guest speaker. We talk about what we're doing at these particular programs. Our board meeting happens right before the networking meetings. And all of these things are open. This process is an open process. We invite you to attend those. We wanted to increase access to senior help. That's where the senior helpline actually developed, making sure we did it in multiple languages. Those magnets were all developed. The development of mental health, all these programs kind of flowed from this. Increasing and sustaining senior mobility. And Shawn is incredible, has done an incredible job in this area. I have to tell you, my wife, who's a medical social worker and works in areas other than this area in Alameda County and some areas in Santa Clara County, says, it is so hard for me to go out of the Tri-City because my role is to set up services, and in the Tri-City area, you're there. It is a piece of cake for me to get my seniors what I need. But if I go to San Jose, I go to San Leandro, I go up to Castro Valley, she says it is so much more of a chore. So we really are lucky within this area to have such a committed community and committed leaders. Increasing the capacity of the community groups to serve seniors. What we know and what we don't want to have happen is government services aren't going to grow bigger. In Human Services Department, we're not going to get bigger. Yet the demand has been increased significantly in this area for services. Services like Life ElderCare, the VIP rides. So what we're trying to do, and part of the goal is to say, okay, we have the knowledge of what works. We have the technical skills to teach what works. So bring your community group in, which is how our Community Ambassador program began, and we will teach your groups how to do these services so we can work in partnership to make sure that anybody who lives in the Tri-Cities area is getting what they need. So we have made multiple partnerships with multiple community groups, faith and ethnic, veterans organizations, etc., to make them a part of what it is that we're doing. We're happy to give away what we know, and that's why we're here today as well. Fostering cross-cultural and intergenerational exchanges, I'll talk a little more about that in a minute, and creating opportunities for seniors to sustain vital and active roles in our community. That age is not defining who you are. We want to make sure that the programs we create involve you and that you become involved in these programs, all the way from the health programs at the senior center to our VIP rides programs, our Meals on Wheels programs, that you can become engaged in meaningful opportunities that make it happen for you. So some of the accomplishments that have come about over the last 6 years is we continue to raise some funds through our annual fundraising activity called the Senior Night Out. This year, Senior Night Out is the night that community residents make a date with generally a frail senior who doesn't get out, takes them out to a night at the Hilton for dinner and dancing and all sorts of fun. This year it's October the 15th. It is a Halloween theme. All treats, no tricks. Should be a fun event. It's actually one of the highlights that I love doing this year. The money that is raised from Senior Night Out actually goes into what we call our personal urgent need funds. These are monies that are accessed by our care managers and other people in the community for a senior who may have their heat shut off because they haven't been able to pay their PG&E bill. So we'll use these funds to help pay that bill. Or perhaps they need a wheelchair or some type of medical equipment. These are one-time funds that our care managers are able to utilize to buy things or services for people to help them stay in their homes. So this fundraising event, the dollars go to help people who really need the help. We've adopted in the city of Fremont an elder-friendly policy in Fremont's 2020 plan, which means that it's not just our Human Services Department which is attending to aging, but all the departments, as they plan their future programs, they now have to take into account, like the planning department. If we build a new apartment, we have to make sure that it is an aging-friendly apartment. So it has some major impacts on the future of development of City of Fremont's programs across the range of programs. We hope that Newark and Union City will explore this policy, adopt a similar one. I'm currently leading what's called the Residential Care Facilities for the Elderly Improvement Initiative. This is where we're providing low-cost training for people who run the board and cares. We have 120 board and care homes, small board and care homes in the Tri-City area with a capacity for housing about 1,200 of our most frail seniors, or people who are rehabbing. We want to make sure that they're giving the best quality of care to our most frail seniors. And it's an area that needs to be addressed. We're working on the partnerships to make sure that this happens. We have what's called the Four Seasons of Health Initiative. Last year, Washington, we actually held one of our 4 seasons on brain fitness here. And we did 4 things on how to talk to your doctor, brain fitness, physical fitness, which launched the Walk This Way programs, and on nutrition. And we do a lot of community education pieces like this. Certainly, if you have an organization or you would like us to come out to one of your groups to speak on our services, you're welcome to contact us, and we're happy to come and do that. Some other key acknowledgments, and Karen mentioned this, our Community Ambassador Program, working with the seven ethnic and faith communities, the veterans groups, and one of the mobile home parks, Tropics Mobile Home Parks, to bring services out, to let them know, to contact people within their communities, link them from services. There's no reason that anyone in this area shouldn't be getting services that can help them live a good quality of life in their home and in our community. And our senior pen pal, I had mentioned one of our goals was intergenerational connections. This is a program whereby we're using seniors to write letters with 6th graders. Can you imagine 6th graders learning how to write letters? Most of the 6th graders we've worked with didn't even know what a letter was. They use email, texting, all that other little stuff I know nothing about. So this has been a particularly exciting project. We've done it for 3 or 4 years now. This year, you'll notice there's the Free Together. We have published our first book in which one of the classrooms interviewed all their seniors. The students then entered their stories, wrote a story about their interviews, entered a contest, and we've published a book called Free Together. There will be a launch at the Alameda County Library on this book. The author will be there, the senior will be there to talk about that. So, as I said, this process of what we're working on is not just about services, it's about getting all of you involved, making opportunities. So we suggest engage in aging and become involved. And all of these are areas, the programs that you can become involved in this area. There are many others certainly, but we encourage you. If you want to keep your brain active, and as a psychologist, I can tell you, activity, physical exercise, good nutrition, and keeping your brain mentally alert, which involves volunteering or engaging socially, that's the best way to be engaged. So the senior center, the volunteers drive that center pretty much. Life ElderCare, we have a need for drivers for the Meals on Meals rides. We have a need for escorts in the VIP rides program and visitors, all of these. When we've talked to people who've been involved in those programs, they have all said, you know something, I know I'm helping somebody else, but the person who's getting the most out of this, I think, is me. I love what I do. Fremont Paratransit, Shawn will talk to you about the Walk This Way programs and other programs. Our Aging and Family Services, the Senior Peer Counseling Program, which I started about 20 years ago, is one of those things which is really strikes to the heart when you're talking and helping people through difficult life transitions. Peer counselors are amazing in the work that they do and what they offer. Pathways to Positive Aging, our community ambassador programs, our senior pen pal programs, these are all areas that we need your help. We don't have enough people to do the work that's required in this area. We need you and we need your help, and we want to engage you in this whole process. So aging is a process that we all share, and we share it together. That concludes us. We're available for any questions that you might have for the next few minutes. Sherry's got a mic back there, so any questions for any of us?
What qualifications or how do you qualify for the 12-week in-home exercise program?
Basically, you really need to be, when we say homebound, it doesn't mean that you can't be out and about and going to in the car, but it really is for those seniors who are more homebound, because if you are a senior that has the capability of getting to the senior center, there are exercise programs there that are available. So this basically is for seniors who don't have the mobility and are at home. So it's 60 years of age or older and are homebound.
Thank you.
Excuse me, I'm interested in the walking program you have. I've seen them going around there near the senior center. How far do you walk? How fast do you walk? How do you, somebody leading you, or what's the story on that?
It is a very low impact fitness program, so that someone does not have to be in super fit shape, right? And we actually have people of different fitness levels in the walking program. The walking program meets an hour and a half. The Walk This Way program meets an hour and a half each week, once a week. And in that hour and a half, there are a couple of things that happen. Typically, there's a time where the group does warm-up exercises together. They usually go out for a walk, but it's not like a whole walk around like Lake Elizabeth. Generally, the walking part of the program is focused on particular walking exercises. So it may be that the group does some fast-paced walking, or they do some side steps or different kinds of things that are intended to build certain muscle groups or balance, etc. So it's not like going out for just sort of a leisurely hour-long walk. Generally, the walking part of the program is maybe about 20 minutes to 30 minutes. They tend to be shorter kind of distances, so that if someone is more fit than someone else in the group, they could maybe do multiple sort of laps on the exercises they're doing. So there's warm-up exercises, some walking, some cool-down exercises. There's always a little amount of time that's spent discussing an educational topic that might have to do with how do you deal with arthritis and physical activity, or issues around nutrition, or issues around how to improve balance. And then part of the program is spent actually doing kind of fun games and activities, which the seniors actually have really found enjoyable, where there are scoop toss games, or different lawn bowling games, or group juggling games. And again, they're activities that are intended to improve balance, flexibility, strength, but they also get your brain working, because you kind of have to, as you're playing games, you have to sort of multitask at the same time. So that's also a part of the program. And I hope that covered it. So we have people of different fitness levels and different, with different health conditions that are participating. And the instructor, we partner with an agency called Generations Community Wellness, which is a nonprofit organization based in Santa Clara County, but they've been doing fitness programs for seniors for a number of years now. And they provide a fitness instructor who has a master's in kinesiology that works with the seniors, and can also, if there's a senior that, say, has had in the past hip surgery or has back issues or whatever, the exercises that are done in the program can be modified so that each person can participate to their own abilities.
What time do you start and how many days a week?
It's 1 day a week, and there's a flyer in your
Yes, I
packet
see
that
that,
lists
the
the 3
22nd.
upcoming programs.
We do not use paratransit at the moment,
Uh-huh.
but we have many doctor's appointments. Some are on time, some are maybe an hour and a half after your scheduled time. How long does paratransit wait for you until you're...
So typically with paratransit services, now remember I said all paratransit services are by advance reservation, so that can present some challenges with respect to dealing with medical appointments. So what we ask is that people schedule both their going and return trip home. Now sometimes that can be hard to judge. Like, you know, I belong to Kaiser and I know that, I have a doctor and I know that you know, sometimes I'm at the doctor's and I'm always at the doctor's office at least an hour and 15 minutes because that doctor only ends up seeing me for, you know, 20 minutes, but I have to wait and all the stuff, right? So I don't use paratransit, but if I did, I would make sure to bank on having, you know, an hour and a half before a ride would come back to pick me up. Now, if for some reason someone misses a paratransit ride, they call the dispatcher and they, you know, for some reason they say, you know, my doctor's appointment ran late and we will dispatch another paratransit vehicle out. Some people will use paratransit to get to their medical appointment if they don't know, like that particular day, if they're going to have to go do some lab work or get a prescription filled, and then they'll use that taxi voucher program that I mentioned afterwards to then get home. So, and there are lots of more specifics that we can get into, like letting the doctor's office know that you're using paratransit, because a lot of doctor's offices will tune into that and make sure that that person gets out on time for their paratransit ride home.